are in listen-only mode.
Okay. Hello, thank you for joining us today for the Master of Science in Behavioral Health virtual information session. My name is Carolyn Arroyo, and I am the Graduate Enrollment Manager with the School of Nursing and Health Professions here at the University of San Francisco. So we're really excited to have a very informative presentation today given by Dr. Kathleen Raffel, who is the Program Director for the Master of Science in Behavioral Health program. At the end of this session, we will address some commonly asked questions. And without further ado, I would like to introduce Dr. Kathleen Raffel.
Proceed with this slide.
Okay. There we go.
Oh. Hello, everyone. My name is Kathy Raffel, and as Carolyn said, I'm the director of the MSBH program. Let me just give you a quick overview of what we're going to cover today in this webinar. First, I'd like to tell you a little bit about the University of San Francisco and how the School of Nursing fits within the bigger program. And then we'll talk in more detail about the Master of Science in Behavioral Health, some of the courses you'll take, some of the things that you'll do while you're in the program. As we're going along, I will also tell you more about what it's like to be a student in our program and to address concerns and questions you might have about what you do with a degree once you get it. At the end of the webinar, we will give you some basic information about admission requirements as well as contact names and email addresses. So let me go ahead and begin by telling you a bit about the University of San Francisco. The University of San Francisco is the oldest university within the city and the second oldest college within the state of California. The university has 5 schools: management, law, liberal arts and sciences, education, and then the most important to us today is the School of Nursing and Health Professions. Among those 5 schools, the University of San Francisco offers more than 100 degree programs and has about 10,000 undergraduates and graduate students combined. So, the Master of Science in Behavioral Health, the MSBH, is part of the School of Nursing and Health Professions. SNOHP has about 1,100 undergraduates and more than 400 graduate students studying in San Francisco, online, and at branch campuses throughout Northern and Southern California. The MSBH program is currently offered only at our San Francisco campus, and our classes are taught in Presidio classrooms at the base of the Golden Gate Bridge. The views from our classrooms are just as stunning as you can see in this picture, and it's a lovely setting for our students. We also have the bonus of ample free parking nearby. Although classes are taught in the Presidio campus, our students have full access to all of the resources on our Hilltop campus, such as the library, the fitness facilities, and things like that. Our main campus is located in the center of San Francisco, adjacent to Golden Gate Park. USF is a mission-driven Jesuit school. What does that mean for you? For centuries, Jesuits have advanced academic excellence in the service of humankind, educating students of all cultures, religious beliefs, and capabilities, inspiring them to strive for justice. Being mission-driven means that we train health professions to be excellent practitioners and skilled professionals within the context of certain fundamental values. So what you would find is that throughout our curriculum, we challenge students to consider issues of diversity and social inequities, and then we provide training so that our graduates have the leadership and critical thinking skills to drive change. All of the programs within our School of Nursing and Health Professions are committed to preparing health professionals who promote equity and positively influence healthcare quality, delivery, and access. The Master of Science in Behavioral Health is one of many graduate school options offered within the School of Nursing and Health Professions. And if you take a quick look here, you can see how diverse those offerings are. Being part of this dynamic school gives us the opportunity to tap in to the highest quality faculty and really create an interprofessional program. In addition to courses designed specifically for MSBH students, our students also take courses in clinical psychology, public health, healthcare informatics, and leadership. In the past year, we have offered a 4+1 option for undergraduate nursing students who begin working on their MSBH while completing their undergraduate degree. In addition, we now have an option for students in the advanced practice nursing program to take the MSBH during their doctoral studies in lieu of completing an MS in nursing. And now, since the fall of 2016, we've offered a new dual Master's in Public Health and Master of Science in Behavioral Health degree for those students who want a broad, in-depth knowledge base in both public health, with an emphasis on behavioral health skills. So, with all these wonderful options, why is the MSBH a valuable degree? Well, let me give you a bigger context and kind of a history of how the MSBH came into being. Despite the fact that the United States spends more money per capita on healthcare than any other nation, we lag behind other developed countries on multiple measures, such as infant mortality and rates of diabetes. Right now in the United States, we are wasting money, we're not being as effective as we could be, and health disparities in this country remain present at rates that should shame us all. About 6 years ago, prompted by the passage of the Affordable Care Act, the School of Nursing and Health Professions convened a work group to see how the school might start addressing these issues. The work group met with various healthcare providers from around the Bay Area and learned that while clinicians could identify problems within clinics and social service agencies, they often didn't have the skills to do outreach, program planning, project management, or quality improvement. What was needed, the group discovered, were professionals who could communicate well with all members of the interprofessional team and lead change efforts. And with these priorities in mind, the planning team designed the MSBH. At the moment, the future of the Affordable Care Act is uncertain. However, the problem of healthcare access, particularly in the area of behavioral health, remains a critical problem. Moving forward, there will continue to be a great need for individuals who can make health and social service programs more effective and efficient. So now let's dig even a little more. How is the MSBH different from other graduate programs? Historically, people have become specialists in physical health, mental health, or healthcare administration. The specialization has advantages, but has also led to our very fragmented healthcare system, which frequently ignores the many social and economic variables that are influencing health and well-being. In the MSBH program, we see individuals as parts of systems in which each component influences the other. We recognize that achieving better overall health requires attending to not only healthcare conditions or physical health, but also to other factors which impact health, such as access, education, and housing. Because the term behavioral health is used differently around the country, I want to take a moment right now to just explain how we are using it when we talk about it in the MSBH program. While some use the term behavioral health to refer specifically to mental health care or substance abuse counseling, in the MSBH program, we think of behavioral health more broadly. In our program, behavioral health involves analyzing and understanding how human behavior is influenced by both physical and mental health, both the mind and the body, and how human behavior can improve our mental and physical well-being. There is increasing recognition that behavioral health is an essential component of improving healthcare outcomes. In addition, healthcare industry leaders are now advocating that physical and mental health care needs should be addressed in one setting with an interprofessional team of providers, which includes those with training in behavioral health, health coaching, and health education. Over the past few years, we found that the MSBH program has attracted applicants with many different undergraduate degrees. We've admitted students with degrees in psychology, sociology, biology, public health, health education, business, organizational development, justice studies, medicine, and nursing. Applicants also come to us with different experiences and long-term career goals. So, over the past number of years, we found that the MSBH program has proven a good fit for a variety of people. Those interested in human behavior, especially the intersection between mental and physical health, those wanting to start a career in behavioral health, or those currently working in healthcare and wanting additional skills in interdisciplinary team leadership, program evaluation, and project management. We've also found that our program has strong appeal for individuals who want a foundation for a career in medicine, dentistry, advanced research in public health, or advanced practice nursing. Wanted to take a break here for a moment and show you a picture of students in last year's cohort and tell you a little bit about them and some of their interests, just to give you a taste of the people who join us and finish our degree. Amber is interested in embedding healthier, more just disciplinary practices in the classroom. Since graduation, she's been working with Seneca Mental Health Services to incorporate restorative justice practices in elementary school classrooms. Cricket entered the MSBH after working many years as a recreational therapist in an inpatient psychiatric unit. During her fieldwork, she directed her efforts to providing harm reduction services to homeless individuals. After graduation, she was hired as the project director for a new program, Back on Your Feet, which offers an innovative model for improving the health and skills of the homeless. Jason studied public health as an undergrad at Cal. He entered the MSBH program to learn about helping men, particularly male athletes, develop healthier anger management and relationship skills. While in the MSBH program, Jason was also a Futures Without Violence Fellow. Callie is one of our Nursing 4+1 students. After she completes her BSN and her MSBH, she plans to work in either maternal or child health or in adolescent health. Our current cohort is just as diverse in their undergraduate majors and long-term interests. So this is the mission of our program. We want to prepare future leaders with the skills to promote social justice, address disparities, and improve the efficiency and effectiveness of the social service and healthcare systems. So let's look more specifically at our program learning outcomes, our goals. There's a lot on the slide. You might want to take a minute. I'm just going to take a deep breath so that you can have a minute to read through these and see the kinds of outcomes that we expect for our students once they've completed all their coursework. One of the things that I hope you'll notice as you read through these learning outcomes is that we emphasize action. Our students learn specific skills that are both practical and relevant. When our students graduate, we want them ready to become active, contributing members of the team. One of the most common questions I get is how the MSBH program is different from other degree programs. And that's a great question because, in fact, the MSBH draws from other disciplines to create a very distinctive degree. Like the social work degree, the MSW, the MSBH emphasizes a socio-ecological perspective. In other words, we look at the whole system, not just an individual. And we also emphasize a strength-based approach, which builds on individual and community assets. Unlike the MSW, the MSBH will not lead to a clinical license. Like the Masters in Public Health, MSBH teaches students about healthcare systems, health disparities, program planning, and evaluation. In the MSBH, however, students do not learn about environmental health, epidemiology, or global health. In fact, our classes stress skills that are particularly useful for local program development and improvement and promoting individual behavior change. Like advanced practice nursing students, MSBH students get training in project management and quality improvement, health education, and health coaching techniques. While MSBH students learn about chronic conditions, they're not trained to deliver treatment. However, they do learn how to be an excellent partner with nurses who are providing direct care. We draw from numerous disciplines to make a unique degree that is practical and versatile. All right, so now here's the list of classes that you would be taking. This is a 34 credit program. There are no electives in the MSBH. The courses have been designed and scheduled to complement each other. Content you learn in one course will relate to and reinforce content you're learning in another. It's not uncommon for faculty to say, as you learned in this class last semester, or what you're learning in this class is something that we're going to build on here as well. We really try to have an integrated curriculum. While you don't have any electives from these course listings, you can choose a fieldwork site that fits your long-term career goals. During your fieldwork experience, you'll complete a project in program design or evaluation. This project is done on behalf of the agency, but you will take a leadership role. And then during your final semester, you'll write up your work in either a capstone paper or a journal article. MSBH students are also given the opportunity and some funding to attend local conferences and workshops to improve other professional skills. If you go to the MSBH program pages on the USF website, you can find this list of courses and click through to the course catalog descriptions for more detail. All right, who will be teaching my courses? As I mentioned earlier, the MSBH is just one of many programs within the School of Nursing and Health Professions, and that gives the program the opportunity to pull the best faculty to teach a particular course. So we have professors with backgrounds in social work, public health, nursing, informatics, psychology, law, and all of them have advanced degrees. Our classes are small and highly interactive, and we pride ourselves in how available our faculty are for both advising and mentoring. Our courses and classroom experience, I believe, are different than what many people have encountered as undergraduates elsewhere. And the best way to find out what they're like is to come, if possible, and do a classroom visit. So if you live in the Bay Area, we encourage you to come visit one of our classes and experience our approach firsthand. All right, so as I mentioned when I was going through our list of courses, we don't have electives, but you do have a lot of control over what you do during your fieldwork experience. So I thought I'd give you some more examples of that because this is really a critical component of our MSBH program. We have projects that go in lots of different directions, but no matter what direction they take, this is your chance to go out and practice the skills you've studied in the classroom. It gives you an opportunity to be on an interprofessional team and to add relevant experience to your resumes. So here are just a few examples. In the picture, you can see Carl. Carl created an innovative social marketing campaign to reduce the incidence of smoking on campus. In the picture, he's holding a tube of cigarette debris, which was part of his strategy to heighten awareness about third-hand smoke. Jennifer, who came to us already with a license in clinical social work, wrote and delivered training programs for healthcare providers on perinatal mood disorders. Two of our students have done fieldwork at San Francisco in-home supportive services. The first student did a detailed needs assessment to learn how the agency could provide better support to in-home care providers. The second student did a project designing materials for newly disabled individuals to help them hire and manage their personal care assistants. Another student, Anne, conducted a needs assessment for an employee wellness program at a mental health agency, then designed and implemented a pilot. She went on to help the agency write a grant for the new program. The grant was funded, and her proposal, her pilot, has been successfully launched as a permanent offering at the agency. To enhance services at a drop-in center for youth transitioning out of foster care, Monique created a self-advocacy training manual. Natalie evaluated innovative nutrition and physical education models, which she delivered to low-income Hispanic middle school children. Natalie has since presented her results at a national conference. And then finally this year, one of our advanced practice nursing students who's currently working on her MSBH is helping St. Anthony's assess whether or not to open a safe injection site for chronic substance abusers. So fieldwork placements are done at schools, healthcare settings, social service agencies throughout the Bay Area. All right. All right. So some practical information. If you attend school full-time, you can complete the MSBH in one calendar year. Our classes begin in August and end in August. We admit only for a fall start. Now, for many students, going to school full-time is not a practical option. So we do also offer part-time possibilities, and every year a few students pick that route. If you want to attend school part-time, then we work out an individualized pattern for you. Some students extend their education for a semester, some for a full year. There are many different ways that we can make this work. Our classes meet in the evening on campus. You would be expecting to come to class 2 nights per week. Because we use what's called a hybrid course format, which is a combination of in-person and online, we're able to very efficiently teach up to 5 courses that have you come to campus only 2 nights per week. It's a bit hard to explain in a quick webinar, but it works very well, and that's what we use throughout the program. We have a cohort model in the MSBH, which means that we admit people together as a group, and you will be taking classes with the same students throughout the year. Now, in many classes, you'll also be joined by Masters of Public Health students, PsyD students, or Doctor of Psychology students, or nursing students, but you'll stick with your cohort from beginning to end. And this has proven to be a really powerful way for students to learn together and to support each other. And then an important thing to mention is that the fieldwork that we've discussed already, and that happens during your second and third semester. So for us, that means spring and summer. You are expected to complete 300 hours of fieldwork total over that period of time. Works out to about a day to a day and a half a week. And this is in addition to the academic classes that you're taking during spring and summer semester. You'll set up your fieldwork hours individually, but you are expected to meet the required number. There is an option for you to do fieldwork at your place of employment, and we can discuss this further if you decide to roll in the program, and I can go into more details with you at that point. So what happens after school is over? Well, it can take different directions. Some of our MSBH grads continue on in school. The MSBH is one step in an ongoing progression, usually to a doctoral level degree. Allison, who's at the left in your picture wearing the white shirt, was hired at her fieldwork site to provide counseling in their adolescent drug and alcohol addiction program. And in addition, she is now pursuing a doctoral degree in behavioral health care management. Evelyn Trejo, who's in the red shirt, was selected by the Minority Training Program in Cancer Control Research. And she has since continued on to become a member of the dual MPH MSBH program after she finished her MSBH last August. Her long-term goal is to do a PhD with a focus on Latino health. On the right side is Io Kubuda, who's one of our MSBH to family nurse practitioner students. He was particularly interested in using integrative approaches such as mindfulness to help individuals manage the painful symptoms of many chronic conditions. She sees herself working in a rural healthcare setting or possibly in long-term care down the road after she finishes her Doctor of Nursing practice. In our coursework, we do definitely talk about healthcare and mental health care and those systems, but the skills we teach are very broadly applicable. So our students may work in healthcare clinics, health plans, health organizations, public health departments, but they can also work in colleges and universities, healthcare centers, business and industry, working in HR or employee wellness, and in the school system. So we are trying purposefully to give you a broad enough set of skills that you can work in many settings. This list here on the slide is the kind of, what do you call those? The job titles for many of the kinds of jobs that our students have applied for and gotten successfully after graduation. All right. So let me be more specific about what students do for work after graduation. Carl at the bottom, middle, you met earlier. He was when I was talking about field work. Carl served in Iraq and Afghanistan before entering the MSBH program. He's really passionate about providing exceptional mental health care to fellow veterans. He currently works as a member of the San Francisco VA telemental health team. To the left is Natalie. She earned her undergraduate degree in public health and worked for 2 years in Belize in the Peace Corps. And after graduation, she was hired as the assistant director of health promotion services at University of San Francisco at USF. At the top center is Ren. She knew when she entered the program that she wanted to learn skills to promote employee wellness. And she is currently the director of HR for a mental health organization. And on the far right is Cedric, who got his undergraduate degree in organizational development. And when he joined us, he was already working for the San Francisco Department of Public Health. During the time he was in the program, he was promoted and he is managing staff at one of the public health department's community clinics. He has his eyes set on moving up the management ladder within the Department of Public Health in San Francisco. What do you need to apply? You must have completed your bachelor's degree, but as I mentioned earlier, you can have a bachelor's degree in almost any discipline and still be eligible to apply to the MSBH program. You must submit 2 letters of recommendation, a professional resume. You need to respond to 2 prompts within the application. You'll find them once you open that up. Specifically, we're interested in your professional goals and how you see this program fitting into the things you've already done and things you anticipate doing in the future. I strongly encourage you to emphasize in your essays the work you've done and volunteer experiences. Those weigh heavy as we look at your application. You will need to provide transcripts from all post-secondary schools. They don't need to be official transcripts this round. Once you're accepted, if you are, then we will require the official versions. Generally, the application fee is $55. Carolyn can talk about that again in a minute. I do want to mention that you do not need to take the GREs. For many people, that is quite a relief. When we are looking at your application, we tend to take a very holistic view. We've looked at everything you submit, not just your GPA. And as I mentioned, we are particularly interested in learning about any work and volunteer experiences you've had, any research experience. All of those are things that we look at. We do ask that you have previous coursework in statistics or research methods and psychology prior to starting the program. We found a very important foundation for entering your studies. We use a rolling admission process, and so we do look at applications as they are submitted. In 2017, we had for the 2017 admission time, we had an early priority application deadline in December, and now we're looking at application deadline in April 2nd. If you are interested in one of the new options that I mentioned for the advanced practice nursing degree or the new dual MPH, MSBH, I'm going to recommend that you contact, get the information in another slide, either Carolyn or me for more details. And we'll come up with that. Right. So, what does it cost? The MSBH program, like all of the graduate programs at USF, costs almost $1,300 a unit, $1,295. They charge by the unit, not by the semester, not by the course. Each semester, you'll be taking between 8 and 13 units, if that helps you budget, up to that 34 credit total. You can make applications for student aid and student loans. That information should be sought directly from our financial aid office rather than through the admission team. And if you look at the bottom there's a link you can use to write down where you can get more information on that. Okay. Turn the passion for social justice into positive social change. This is the vision that we have. Is it yours? It's the vision of the students you see on this slide. And if it's your vision, we hope you'll seriously consider applying to the MSBH and joining us on our journey to improve health and mental health care for people in the United States. All right, time for questions. But before we do that, I do want you to take careful note of my email address, Kathy Raffel. It's the top listed one. Or if you wish to get in contact with Carolyn, you can reach her through the admissions team contact. And you're welcome to do that. That's often the most effective way if you have very specific personal questions. But Carolyn and I are going to talk now about common questions that other students have had, and maybe that information will help you with yours too.
Okay, thank you, Kathy. I think one of the most common questions that we get is it possible to work full-time while in the program?
Oh, that's a great question. So my answer to that is a bit of it depends. But my observation is that students who work full-time, up to 3, maybe even 4 days a week, seem to be able to manage the intense academic work of the MSBH and their work and do okay. It's a heavy 12 months, but it does appear to be doable. Each year we have 1 or 2 students who attempt to work full-time and do this program full-time, and that is very, very demanding. If you have other choices, that's not what I would recommend. I would either recommend that you try for the 12 months to cut back on your work, or you talk to me directly for advice on how to go to school part-time. I won't say it can't be done, because every year it is done, but it's very hard work. So something to think about, and something we can discuss.
Yeah, definitely something to think about. Okay. I think you already addressed this, but what kind of career services does USF offer?
Okay. So that's a little different, because I talked about some of the things our students have done. We try very hard to offer our students seminars, workshops, and individual assistance through career services on things like writing cover letters, updating your resume, getting it to look like it really should look for the kind of jobs you're seeking, how to build your LinkedIn profile, how to network, how to follow up if on an application, how to follow up with a second interview. So we have historically offered workshops like that for the students. Then in addition to that, we regularly, in fact, often multiple times a week, send out announcements to students about job postings in the Bay Area that seem relevant to students. And then occasionally I'll spot something that just seems perfect for an individual, and so we pass that along as well. So that's how we've been handling it.
Great. Oh, another very common question. Do I have to find my own fieldwork site?
Okay. You can find your own fieldwork site, and some students come in with an idea in mind of what they would like to do, and that's perfectly fine. But if that's not your case, or you're not from the Bay Area, we absolutely do help you with that. We have already a list of agencies that are options in the Bay Area. Some of them we have a good, strong relationship with already, but other ones we know that will work well, and we definitely assist with that.
Great. Is there an online option?
Okay. The MSBH program does not offer an online option. There are occasionally other classes that might be online. Perhaps one of the public health courses that you're taking could be offered online, but that's not the approach that we use. I will say, though, that you will be doing work online as part of our online format, but they're not fully online courses. You're still expected to come to campus 2 nights a week.
Okay. Okay, great.
Any other questions on your list?
There isn't any on my list. Can you think of some that maybe have come up that aren't on my list?
We are whispering here, trying to figure out if there are other things that come up that haven't been mentioned.
I do. I have gotten some questions just from international students and wanting to know the process for international students. So I will say that there are separate requirements, additional requirements if you are needing to apply for an F1 visa, and we have a very detailed, there's a lot of details on the website with regards to the exact requirements. So if you have questions around that, please feel free to email me either at the health@usfca.edu email, or you can also reach me at C as in cat, ARROYO2 @usfca.edu. Or you can also contact Dr. Raffel, and she can forward that to me if it's something that she's unable to answer. But I think that's
all right.
pretty much it.
So just a reminder that if other specific questions come up, things we haven't covered today, or they're just really particular to you and your circumstances, don't hesitate to contact us at the emails that you've been given. And we look forward to hearing from you. And
well, I also would like to mention that we are currently accepting applications for the fall, and also that all participants that are listening to this, you will be able to receive an application fee waiver. So that will waive out the $55 if you're interested in wanting to apply to the program.
I just thought of one last question, and so I'm going to jump to that, and then that will be the end. I mentioned briefly the new dual degree, MPH, Master of Public Health, and Master of Science in Behavioral Health that started last fall. It takes approximately 59 credits to complete this dual degree, and you get both of the degrees when you're done. And by taking this option, you can actually save 20 credits over completing both degrees independently. Now, that means 20 credits is essentially 2 semesters, and it is well over $20,000. So there's substantial time and money savings if you're interested in both of these degrees. So I encourage you also to consider that option. You can find more on our website. Time to completion, you can complete it in 2 years or less if you attend full-time, or you can spread over additional years if you wish to. And as I said, we always have students who want to take that part-time path, and so we are here to help you make that, whatever path you pick, successful. And this is a degree combination that is one of a kind in the United States, as far as we know, and it's unique to school nursing and health professions here at USF. So if you want more information on that, contact Carolyn or me, as indicated on that last slide. Thank you.
Thank you, everyone, for joining us. Please visit us, visit our website, visit Facebook. We also have Twitter and Instagram. But and please, as Dr. Raffel said, do not hesitate to contact us if you have any additional questions. Thank you so much for joining us.